Hi, my name is Dr. Yuri Burston. I'm a veterinarian in Vancouver, BC, and I'd like to welcome you to my series of practical skills for pet owners. We're here today with Cedric to talk a little bit about just the basics of canine physiotherapy and massage. Now, this is basically going to come in handy if your dog has had a surgery or an injury that they're recovering from, if they had their leg in a cast for a while, or if they have a knee injury. Knee surgery is probably the most common orthopedic procedure done on dogs, and they really benefit from physiotherapy following that. Another scenario in which you might be doing this is if your dog has had back surgery or a back injury or an intervertebral disc disease, and you're taking a medical approach to managing it, and you're just kind of trying to mobilize their muscles and just help them recover their strength and sense of balance. So the very basics of physiotherapy, there's two things I'm going to show you today. One is range of motion exercises, and the second one is just a little bit of basic massage. Now, range of motion exercises are meant to mobilize a limb, get it moving, particularly if it's been stiff or not used for a while. Again, I'll work mostly on the hind limb because the hind limb is the most often affected in dogs. So you see this handsome muscular leg. Now, if this leg was in a cast for a while, you'd probably lose a lot of muscle, called muscle atrophy, and you'd probably have a stiffening of the muscle and the tendons, which would make it hard for him to move his leg normally. See, a normal dog can flex that leg right up and extend it all the way. So the goal of passive range of motion exercises is just to move the limb through the normal range of motion from maximum flexure to maximum extension or standing extension to the limit that your patient allows you. Now, this can be quite painful, so you want to make sure that your pets have some pain control on board, and you want to make sure you're not pushing them too far. So the way I do this is just let them rest their foot and just test to see where they're comfortable. And it might be just a little bit flexure, it might be flexing all the way, and we really just want to move that leg up and down. It's okay, you want to sit down? That's totally fine. We'll use the front leg. So you can do the same thing with front legs. Just, for example, if this was for the elbow, we'd be moving the leg like this, and we'd find a little resistance. So Cedric's resisting me a little bit now, and say, okay, well, this is a maximum flexure that you're comfortable with. And then we'll just work within that range, up and down, up and down. And our goal is to do this 10 to 20 times, 2 or 3 times a day. Now, if we're recovering from surgery, that'll be more than enough to get blood flowing back to the limb and just start stretching out the tissues. And our goal is to get to normal. So if his range of motion is less than normal, we just want to get him right to the edge of that without causing him any discomfort. Just get to the edge of that. And you have to be a little bit sensitive, you be aware of your pet's comfort level because we never want to do anything that hurts them. Just get them right to the edge of where they're comfortable and work just within that range. So I'll demonstrate the hind limb again. This is the most commonly what you'll be doing is just pushing up on this leg just till he's comfortable with the flexure and extending. Push up and extend. And it's not always this easy. Sometimes they'll wiggle around, or if it is uncomfortable to them, they might turn around and chew on your hand or give you a little lick or give you a worried look. And that tells you they're getting to the edge of their comfort range. You don't want to push it too far beyond that. So just passive range of motion exercises, just like that. It doesn't seem like much, but it really, really helps recovery after surgery, after slip disc, or after really any kind of injury where the limb is immobilized. Now, the other thing we're going to talk about is massage. So the goal of massage, again, is just to get blood flowing back to the muscles and just to soften up any stiff tissues. So dogs have a big muscle belly on the back of the leg here. They have a smaller muscle belly on the front of the leg, just in the front of the outside of the leg here. And what you often do is you often do the massage before the range of motion exercises just to warm up the limb. Basically what I'm doing right now is just gently rolling the muscle belly with my hand. You can do it like this, or you can do it like this. Just gently roll the muscle belly. Start up high and work your way down, and then work your way back up. Here you go. Same thing with this little muscle belly just below the knee. You just start up near the knee and work your way down and then move back up. And again, this is just going to get blood flowing back to the limb, soften up those muscles. He's kind of looking back at me going, what the heck's going on back there? Does that feel nice, Cedric? Yeah. Dogs will yawn when they're a little confused. They're not quite sure what's going on. So that was Cedric telling me, he's like, I'm not sure what's going on here, but I'm probably okay with it. You can do the same thing with his back. Back massage for a dog is really simple. I mean, it's not that much different from just petting him. You can start off just making nice contact with him. And again, just circular motions. He's got a spine running right down the middle of his back. Big muscle bellies, the lumbar muscles, either side of it. You just want to gently massage. Dogs with back pain or a slipped disc will often be quite uncomfortable if you push directly down on the spine. It's one of the tests that veterinarians do to diagnose these problems. So you want to work from the sides up, work that big muscle belly, and again, just kind of soften those muscles up, get a little blood flowing. That feels pretty good. Cedric's leaning into me right now because this feels quite nice. And again, this can be the warm-up before you do passive range of motion exercises. That's a good boy. With the front limb, exactly the same thing. You got this big muscle belly on the back of the leg. This is triceps muscles. You can use your hand like this and start up high near the shoulder and just little circular motions down towards the elbow. And then work your way back up towards the shoulder from the elbow. And again, that kind of warms up this whole area, so then you can do your passive range of motion exercises, getting that limb going. Now, this is just the early stages of physiotherapy. There's a bunch of other exercises that you can do as the limb gets stronger and your pet recovers from whatever the initial insult was. But for now, in the initial stages of injury, this doesn't seem like much, but it's enough and to make a big difference to how fast they get back to using their limbs. So when you're doing any kind of work with your dog, particularly if it might be a little bit uncomfortable, it's important to make it nice for them. And the way we do that is with positive reinforcement. So I have a few little treats in my pocket, and as I'm doing the massage, I'm going to offer them to Cedric. So here you go, sweetheart. I hope you found this video useful. And if you like it, please like, please share, and please remember to have fun with your dog.